has been organized by a partnership between the Madison Valley Ranchlands Group, Madison Conservation District, the Ruby Valley Conservation District, and the Montana State Extension Office out of Butte. The first presentation was on first aid. If you missed this discussion, a link can be found in the chat box. To receive a first aid kit from this speaker series, we would like you to reach out to Linda with the Madison Valley Ranchlands Group. Another link will be in the chat box to get a hold of her. The final two Rancher Roundtable discussions will be on February 9th, which will be talking about grasshoppers, and then February 22nd, and that will be discussing grazing for improving soil health. During this presentation, we ask you to stay muted and keep your videos off. Any questions that you do have, we would like you to ask in the chat box, and we will be sure to be checking the chat box to make sure we're answering all those questions throughout this speaker series. At the end, a survey link will be provided in the box as well, and we would love to hear your feedback on this presentation. So with that, we are going to introduce our first presenter. That is Carla Stanford. She is with the Department of Animal and Range Sciences at Montana State University. So a quick background on her. Dr. Stanford has served as an extension beef cattle specialist at Montana State University in Bozeman since 2019. She earned her doctorate in bovine reproductive physiology from University of Florida and completed her master's at Texas Tech University. Her research interests include investigating maternal and fetal interactions, nutrition, and therapeutic interventions in compromised pregnancies and environmental influences on fetal and placental growth, as well as assisted reproductive technologies and supplementation strategies to improve reproductive success and performance in beef cattle. Her extension goals are to develop programming that assists producers with management considerations, promotes practical assisted reproductive technologies for cow-calf production, and bridges the gap between those in extension, research, industry, and production. Carla enjoys hiking, hunting, and fishing with her husband, Michael, when they are both not working in the Montana agriculture sector. The Stanfords are members of the Holy Rosary Catholic Church and enjoy being part of the Belgrade community just outside of Bozeman. And with that, thank you for joining us, and we will get kicked off with Carla.
Sorry, I was not trying to do strange signals. I was trying to get my unmute off. So hopefully you can still see that screen.
It's there.
Okay. And alrighty. Well, thank you so much for joining all of us this evening. I wanted to talk about calving season management. I'm going to kind of do the first half, and then thank goodness we have Dr. Oliver here, who's going to be able to bring years of experience as a local veterinarian and talk about some really great tricks and tips for when we get in a bind and when you're actually having to assist with calving. So, calving management, calving season management, why is it important? Well, it's critical for cow-calf operation success, also for animal well-being, profitability. I mean, we could just go on for days as far as the importance of cow-calf management, especially during the time of calving season. And so I think we first have to start off talking about basic anatomy. So this left figure is actually showing that of the reproductive tract when it is open. She's not pregnant. And then on the right, we're showing that late gestation pregnancy, that fetus. And then this is actually a pregnancy when that fetus is in normal or correct presentation. And we'll talk a little bit about the importance of presentation of that calf and where it's sitting in the reproductive tract. And so as we think about presentation of that calf, how it's sitting in that cow, we can't not think about calving season and dystocia, right? So calving season can be really difficult. It can be labor intensive, and it can be difficult on the cattle as well as those folks that are assisting them, especially during these long winters that we have in Montana. And so dystocia is delayed or difficult calving. Okay, and so it can be hard on the calf, but it can also be hard on that cow that's giving birth. And so we often see this either because that calf is either too large for that dam, or the dam's pelvis or that pelvic area is too small. And then we can see this when that calf is being born in an abnormal position. And so dystocia is more common in our first-time calvers. And so those, we see it in those heifers. We can also see it from time to time in our mature cows. And so when do we know if dystocia is really a problem in our herd? And so veterinarian Mark Hilton, who's out of Purdue University, recommends making a note when dystocia happens in your herd. And so if it occurs in more than 3% of your mature cows or 15% or more in your heifers, then we know that we have a genetic selection issue going on. And so we need to take that into consideration. So dystocia, it's something that, it's an issue right there and then when we're trying to assist that cow as she's calving. But then we can also have negative impacts on that female going into her next reproductive stage. So we can have reduced fertility in those females in that next breeding season. So thankfully, there's a few things that we can do to minimize dystocia in our herds. And so that way we have healthier cows and calves, more productive calves and females. Using bulls that obviously are going to have calving ease direct EPDs so that we can minimize the chance of getting those really large calves and those smaller females. That's extremely important when we're considering our mating decisions for our heifers, our replacement heifers. And so days before that cow or that first calf heifer starts to calve out, there's actually a hormonal initiation to calving or parturition. And so this is a graph from a textbook that we use for teaching. So it's Pathways to Pregnancy and Parturition by Dr. Singer. And so what we have is different changes that occur in the hormones of the cow and that calf leading up to that event of actual calving. And so leading up to it, essentially that calf runs out of space in the uterus. It becomes stressed, and it's going to produce that stress hormone that we've probably even heard about in humans, cortisol. So that's why we have that increase on this graph over that time, those days leading up to parturition on that x-axis. And so we have relative hormone concentration on the y. So that black line showing that fetal cortisol is just increasing exponentially leading up to day 0, which is when that cow is going to start calving out. And so we also have a surge in estrogen. So that's coming from the placenta. And then progesterone is going to drop while that prostaglandin hormone is going to rise. And so estrogen and prostaglandin are responsible for myometrium contractions. So you think about that's going to create an increase in pressure in that uterus. Prostaglandin is also going to cause a hormone called relaxin to surge. And so it actually does just that. It causes relaxation, if you will, of the pelvic ligament. And so it stretches out. And we'll also see it create where from hooks to pins, these females start to kind of relax. And so cervical stimulation is going to cause the release of a hormone called oxytocin. And I'm sure that Dr. Oliver will talk about administration of oxytocin, when that will work, when that won't work. So it's all important to realize that there's so many hormones that play a role in this orchestra of leading up to calving. So there's going to be those inward changes, those hormone concentration changes, but there's also other things other than hormones. That calf is rotating into position into that birth canal. through the course of calving. And then we're also going to see some other changes. So in this image, this is actually a Brayford cow, or a Brayford replacement heifer, first calf heifer. So her vulva is a little bit more relaxed than what we would typically see in an Angus. But I think this is a good picture because it shows a few different things going on. So we see that there's an outward change of her udder. And so you can see in that picture, she's actually kind of distended. Her udder is full, and those teats, we call it, her teats are strutting, so they're actually kind of pointing outward because she's filled up in the udder leading up to parturition. So we have those changes in the mammary gland as she's preparing for lactation. We're also going to see that area between the tail head to the pen kind of start to sink in and soften because of that hormone relaxin. And so that relaxes that cow's or that heifer's muscles, joints, and ligaments in preparation for that calving. And that starts to peak around 12 to 24 hours before actual calving. We can also see in this image that the vulva is starting to enlarge. It's softened, and we got some mucus discharge, and not that pretty clear discharge that we love to see when we're doing AI, knowing that animal's going to be receptive when it's the right time, or checking heat, but rather we can kind of see that yellowish tone, brownish, looking at the cervical tissue, cervical plug, and then that darker discharge. We can also see that heifer or that cow have some behavioral changes in the nesting. So she'll actually move out from the herd. She's going to isolate herself, and she's going to exhibit what I would consider nesting instinct. So kind of having these thoughts on behavioral changes that occur before parturition or calving is really beneficial because, we can kind of sit out there all day and really stress ourselves out about whether she's actually calving right now or is she just in preparation. And so this is some data out of Denmark. So a researcher investigated these behavioral changes in dairy cows, but I think it's still really applicable to what we should look for in beef cattle leading up to calving. So they recorded changes starting at 12 hours before calving, and they looked at how long that animal lied down, how many times she lied down in an hour, her feeding and drinking behavior, and then contractions. And so you kind of say, well, you think about a woman in a hospital, how are they doing the contractions? So what they did, they kind of counted contractions by looking at just the movement of the abdomen and the hind end of the cow, and looking at the duration of minutes over an hour. And then also how many times that female turned her head. And so this was that cow either lifting her head and looking towards her abdomen, kind of where that pressure is coming from. We'll especially see this in those first calf heifers that are just really confused about what's going on. And so there are 3 stages of parturition. And so stage 1 is early labor. And so on the inside, that cervix is going to dilate and that calf is going to move into place. And so that we can really see that in this image from the Dross project out of the University of Florida, that calf is in correct presentation and moving into the birth canal, and the cervix is completely dilated, allowing that. And so uterine contractions are going to cause that calf to move into the birth canal. This can take anywhere from 2 to 6 hours in calves, but it can take much longer in that first calf heifer. As far as some other things that we can see as far as behavioral, they're very restless. So showing signs that she'll either, be trying to find a place to lay down. She might lie down and then get back up, kick at her belly, and then she may also even hold her tail up or even to the side. And so again, just to reiterate, because of that hormone relaxin, we have that softening hooks to pins, and we can see that a little bit better in that image on the right with that Brayford replacement heifer. So some other things to take in consideration. Sometimes we talk about seeing the bag or seeing the sac. And so here's an image kind of showing the different fetal membranes. So moving from the innermost, so that's the amnion, which surrounds that fetus. It's fluid filled. It's a fluid filled cavity. It's there to protect that fetus in development. The allantois is kind of the interface between the fetal and maternal circulation, which is so important to that fetus growing. And then the chorion is closest to the uterus. It encloses that embryo, other membranes, and we associate that with kind of the lining of the uterus that forms the placenta. And so in this image we can see the amniotic and the allantois, what we just kind of collectively consider when we say water bag or water bag breaking. So that's what we're actually seeing during that time if we're able to see it before. Stage 2, so this is the actual act of labor when that female is going to start straining and pushing that calf out. So this is when we see the sacs, or that what we may consider the water bag, appear, and then it will break. And so during this time, this calf will go up and over the dam's pelvis. And so we will first see the bag or bags, then the feet, and then the nose of that calf. And so this may last 30 minutes up to 2 hours. If assistance not needed. And so that's one thing to kind of take into consideration, is being able to watch these females and know how long they've been straining and pushing. So the key thing is that to look for this, and if we're not seeing any kind of progression every hour in stage 1 and stage 2, and that cow's actively straining for more than those hours, and there's no progression of the calf coming out, that's when we start thinking that we really need to check her and see if something wrong is going on. So the last stage of parturition is expulsion of those placental membranes after the delivery of that calf. And so this may take as little as 30 minutes, but it can take as long as 2 hours or even 12 hours. Technically, if it takes longer than 12 hours, we start to consider it retained placenta or fetal membranes. And I know that historically I had heard of veterinarians recommending manually removing these tissue. And I'll let Dr. Oliver speak to this, but I know, as time has gone on, it's more advisable to kind of allow that cow or that heifer to shed those membranes on their own. And this might take some time, but by pulling, we don't want to pull so that we're not potentially preventing, we don't want to cause any kind of infection that could occur. And that's an important reason to make sure that these animals are calving out in a clean space with appropriate bedding, especially in times of issues like that. Research in dairy cows has reported that when the placenta is manually pulled, it actually delays the return of estrus by 20 days or more. So that's definitely a reason right there for us to just let her pass it on her own. Also, during this stage, this is when that dam is going to start mothering up and showing really good signs of bonding by licking and cleaning that calf. So that this first calf heifer in the picture is doing just that. We can see the placental membranes there, or the afterbirth as we commonly may call it, lying on the ground, and then that calf is sitting up, looking good, and she is already cleaning it, bonding, showing really good maternal ability. We'll hopefully notice that female ingests the placental membranes. This is a really important time that we leave this pair alone and let them bond. And sometimes we can get into issues either with research or just trying to identify calves, where we get in there, especially with first calf heifers, and they get really confused about which calf is theirs, or us creating an issue where they may not want to take that calf back. I'll definitely let Dr. Oliver speak more to this. These are kind of just the ABCs of calf care that I go by, because we can have weak calves. We could have calves that could die. And we do have calves that die, shortly after or during calving. So we want to make sure the ABCs of airway, breathing, and circulation. So we want to make sure that airway is clear of mucus and fetal membranes. We want to make sure that calf is still breathing. So clearing the mouth with your hand, and if it's necessary, stimulate the calf to breathe either by rubbing it vigorously or stimulating the nostrils, and then definitely using towels or, a warming hutch to dry those chilled calves. And so we also want to put this calf in what's considered the recovery position. So that's what this picture is. So this was a veterinarian that developed, or, from observations, term this the recovery position. So both legs are tucked underneath and outward. And by sitting up this way, it's theorized that the lungs are able to expand with the least amount of pressure versus that calf laying on its side. Additional priorities, we want to make sure that calf is standing, that cow allows that calf to nurse. So that's really important. Seems like as more and more research comes out, we put more importance on when that calf gets colostrum, or that first milk that's so important to their immune system. And so we want this as early as possible. If we can, hopefully it's going to be in that first hour of birth, especially with dystocia calves. Those compromised calves tend to have a poor suckling reflex, so they don't consume enough of the colostrum, and then that first milk from the dam is really packed with nutrients, immunoglobulins, and energy. You can use an esophageal feeder or a tube to provide a colostrum replacer. The best scenario is for that calf to receive its own dam's colostrum, either from it nursing her or, bottle or tube feeding it because you milked her out. And then the next would be that commercial colostrum replacer rather than a supplement, because that supplement's just not going to give that calf the needed antibodies that replacer will. And those products can come as a powder. You can mix them with warm water. Colostrum can be frozen, which is more commonly done in the dairy industry, where they can more easily milk the dams. And so, as I mentioned, that dystocia can result, or parturition can result in dystocia, so that delayed or difficult birthing. And so this can be from that calf being too large or the dam being too small in terms of pelvic area. So if you're some replacement heifer development programs will do using a rice pelvimeter to determine pelvic area, to determine, for her age and breed, is she on course for being, large enough in that pelvic area. And so we show that in that image here. We can also have issues of dystocia, that small female or oversized fetus. You can have twins or abnormal presentation. And again, dystocia can lead to issues with her fertility later on. We can have retained placenta due to dystocia, but also dystocia due to poor nutrition. So it's going to lead to longer interval for postpartum, that postpartum period. So that female is going to need more time to recover from dystocia, and any potential infection could occur. So we want to do everything we possibly can to prevent dystocia. And then when that time comes, we want to act quickly, assess the situation, help the calf, help the female, and definitely have both of them come out with the best case scenario. So this just kind of gives you an idea of normal presentation. So legs up in the birth canal, head in between those legs, rear legs forward or up in that uterine space. And then here's some of the potential abnormal presentations that can occur. And so you can see abnormal presentations, from what I've read, in about 5% of calves at birth. And I'll definitely let Dr. Oliver talk about, cases where, different things that could be done during abnormal presentation, and then, when is a C-section going to be performed. In terms of having our ducks in a row, in case we do have an issue, having a maternity area, having the barn ready to go, a calving pen's great so that we can restrain the female and we don't have to worry about her going down in a traditional squeeze chute. At least we want to have a working head gate, lights when the time comes. And if we're going to have to pull a calf, we want a complete calving kit ready, OB chains, handles, and lube. So one thing I thought was neat is that, so we have a local producer in the Livingston area. So Matt Pearson over at Highland Livestock, he noticed that he had some first calf heifers that he just had a really difficult time getting them to go into the head catch so that he could assist them. So this is his setup. Those panels will swing out if she ends up going down or you need to get in that space. But he had a local artist paint that really great picture of a cow walking out on the far door of that room. And he said he's just been really happy that those females will just walk on in there because they just think the next one's going out in front of them. So I thought that was really, really creative, and it definitely works for their operation. In terms of the calving kit, so you want to have gloves, mild soap, OB lube, disinfectant, buckets, paper towels, as well as having regular towels for drying that calf off, iodine for dipping the calf's navel, as well as potentially that calf jack and that puller, a tube feeder, colostrum replacer, and then of course, if Dr. Oliver's your vet, you want Dr. Oliver's contact information in case it goes bad. Being able to properly restrain that cow, whether that's a rope or facilities and so on and so forth. You definitely want to be able to identify that animal, identify that calf, so that you can keep a record of, potentially if it was a difficult calving or anything, to go wrong, potentially weak calf and so on and so forth. A tape potentially to look at the birth weight using that hoof meter tape. So using an estimate of the birth weight based on the hoof diameter. And then anything recommended by your local veterinarian that you need to put in your calf kit. Dealing with winter calving, so we definitely can have issues of weak calves. I could tell you stories of producers that have had difficulty with their wean calf prices, what they contracted out at due to frostbite issues, okay, which can cause flesh wounds. Having that colostrum is so important, getting it in those calves as early as possible, at least having that replacer. In adverse weather, in terms of if we have a short-term storm, so not a long-term polar vortex or something that really settles into that area, there is a USDA livestock indemnity program that can provide 75% aid to ranchers who lost their cattle during that short-term event. So that's something to take into consideration. As far as calving monitor technologies, there's a few things out there. It seems like it's becoming more and more difficult to find good labor, train good labor, and retain good labor, especially during calving season, because it's just extremely labor intensive. It's exhausting work, but it's so critical to the performance of an operation. So the best case scenario is human eyes, right? A few other things. This is a device. There's so many different, I will say there's so many different technologies that are on the market across the globe. But this is a device called a Mucal calving sensor. And so these are made in Ireland. They've been out since about 2015. And essentially what it is it's a sensor that you have to place on the tail of the animal. So you actually got to get her up, or, if it's a 4-H or FFA project, you could probably just walk up and put it on her. And it was developed, essentially for dairy cattle, where it's easy and it's not as time consuming to place that on the tail of these females. And it essentially gathers tail movement patterns, which are triggered by calving contractions. So once it detects a certain level of intensity and movement over a specific time or, specific period or time, it's actually going to send you a text message on your phone. And this is typically the first one's going to come about 2 hours before she actually is calving. And then it's noted that the second one is going to come about an hour right before she calves. So these sensors are about $300 a sensor. That comes with the software and then the service for the first year. And then they charge about $130 every year after that. So you got to take that into consideration. Is that something that you want to invest in? What's neat is that it's going to be able to give you an estimate of when she actually started calving. So, in those times of dystocia, and kind of help us determine, when she may need some assistance. Definitely some other options are cameras. So that's a handy investment, in my opinion, of these ranch cameras. So you can use these for checking females during calving. What's particularly beneficial, I think, about a camera system is that it's a fly on the wall. So we're not disturbing that female, that cow, or especially that first calf heifer that's not as experienced in calving. We want them to be able to be calm, relaxed, and we don't want to go in there and disturb them. And so this essentially is a camera that you could use for calving, but you could also use it for general security around your barn, or equipment shed. And then they also have some that are solar powered that you can use for checking water tanks. So I wanted to talk about two different options of systems you can find in Montana. And one is cow cams. So essentially it uses two antennas, and they can be placed up to 5 miles apart. They run off of a computer software, and according to their website, it's all ready to go, and you essentially just mount it up, the cameras, and plug them in. It comes with 3 indoor cameras for around $1,000. And so they do have different cameras that are recommended for the outside of your barn that you could use, and essentially they can see as far as 400 feet away. So they don't require high-speed internet. What's interesting, or what's really handy, is that you can pan, you can tilt, and you can zoom in all from your device. So that's pretty handy, in my opinion. Another option is Ranch Eyes. So that was developed by Timber Mountains Technologies, and they advertise this for calving, lambing, foaling, that security watch concept, whether it's grain bins or, your gas tank or expensive equipment. These cost around $1,500 for either 1 to 2 cameras, and then the price kind of goes up from there depending on what you want. As far as the specs on these, they are high definition. They're color cameras. They're in a weather-resistant metal housing, so you can mount them up on or in a barn. These cameras also will pan, tilt, and zoom. So I think this is a really great image that we have here, and it will give you a good image within a mile, according to their website, within a mile in the day, a mile away in daylight. And then it also has infrared vision, which is going to help seeing in the dark within 300 feet away. So the system will transmit up to 2 miles to the receiver. And so if you have high-speed internet, you can essentially go anywhere and be able to use it on your device, your phone, laptop, etc. What I particularly like about this image on the right from their website is that it's really impressive in terms of having the ability to use that camera to zoom in and really assess the calf presentation. And so even in this calf, this calf in this situation here, that mouth is clear, the nostrils are clear of any kind of placental membranes, which could cause suffocation. And so that's really handy, in my opinion. So I know Dr. Oliver is going to discuss the specifics, of what to do once you determine a female is actively calving. So I don't want to, get into that information. I want to stop there. If anyone has any questions, or perhaps Audra, I don't know if you want questions. I will be on for Dr. Oliver's presentations. I don't know if you want questions now or later. But also, please follow Montana State University's Beef Extension team. So we're on Facebook, Instagram, as well as Twitter. So we'll have industry, research, and extension information, and even events on there posted up. So please go look at that info. Thanks for your time this evening. Feel free to email me if you have any questions that pop up. Audra?
Hi, hello. Sorry about that. So we can take any questions that we have for Dr. Sanford as they come in. What we can do is just maybe turn on your video or raise your hand, which you can do in the little reactions at the bottom of your screen. All right. So there was one question in the chat box. It asks if there is any abnormal presentation, a genetic issue.
Abnormal presentation?
Yep.
I may let Dr. Oliver have that question about abnormal presentation, about the genetics, and not specifically for that variation that could occur in that individual female.
All right.
Okay. I got that question about 20 years ago, shortly after I came to Montana, and I was about 2 to 3 years out of vet school, and I said, nobody ever said anything about that to me. Fast forward a ways, and I will tell you that I think true breech calves could potentially have a genetic correlation. I don't have a research project. I just have a few years of observations. So potentially, maybe a true breech calf.
All right. Thank you. I do not see any other questions right now, but maybe we can just get going on Dr. Will's presentation and then take questions as he is speaking and after during a Q&A. All right, so Dr. Will Oliver has been practicing in Three Forks since 1996. His practice, Shooteside Vet Services, is purely large animal, providing services both on the ranch and in the clinic for clients throughout Southwest Montana and beyond. Shooteside is a 3-doctor practice with well over half of its work in the beef cattle industry. When not at work, Dr. Oliver and his wife Heidi enjoy keeping up with their family and children. They have raised a couple of bobcats with a third dreaming of blue and gold for their future. Academics and sports have provided lots of good times, from the science fair to the football field to state championships in bobcat track and field. Now, Sundays at church help keep everyone connected and grounded. Helping agriculture forward and keeping our lands productive is particularly important to the team at Shooteside Vet. And with that, we will hand it over to Mr. Oliver.
Okay, let's see if we can share a little content. Okay, good evening. Thank you for having me. As they mentioned in my bio, we are a 3-doctor practice. I came to veterinary medicine in 1994, started off in western Nebraska, practiced there a couple of years, moved to Three Forks in 1996, worked in a practice in Three Forks for about 3 years, and started off in 99 as Shooteside Vet Service. We're a 3-doctor practice now. Dr. Chelsea Petz, Dr. Ross Tuning are my associates and good help. Kristen Bailey was a certified vet technician with us for a number of years, and we sent her off to Carcass Ultrasound School, so that is another aspect of our practice, and we are straight large animal practice, purely that. We offer services on the farm or the ranch. We have a haul-in facility. Well over half the practice is beef cattle, and we cover call 24/7. I would say that if we don't pick up the phone, please leave a message. We will get to you. I put these slides up over the course of the last 10 days or so, and I had put in who's here tonight, and I can see that there are a lot of you here tonight, so thank you for coming. Back to calving ease and calving ease selection. It's been a huge benefit to our industry. And if you look at the number of calving problems that we see as a practice versus the number of births or the number of cows that we're potentially responsible for in a given year, it's a very small percentage. And I attribute that to two things. I attribute that to good bull selection, and I attribute it to the people out there calving the cows, because I think we have a lot of people that are very handy at what they do. Our topics tonight, four general things. We're going to talk a little about supplies. We're going to talk about some general rules of thumb, and we're going to talk about assisting delivery and after the delivery. So tools, I think you'll find my list is not that different than the one you saw before. I have on there a light source as being pretty important. Frequently a headlamp versus a flashlight. If you put a headlamp on, you got two hands free and it's pointing where you're looking. And then a bucket, a clean bucket, a dip cup, some warm water with disinfectant, disinfected soap, a little J-lube powder, and you see sleeves is in bold. If you do nothing else, please put on a pair of clean sleeves. Chains or straps, I like chains. I think I can keep chains cleaner going from place to place. I know some of you like straps and you're using them on your own place. Please keep them as clean as you can and go forward. And now you see a curved horse sweat scraper. That's sort of a new thing that I put on the list in thinking about this presentation. We buy them at Murdoch's. It's a little blue semicircular squeegee. We use them in AI and we use them spay and heifers to very rapidly clean a lot of debris off the vulva. And if you're in the middle of it and a cow unloads on you, I know that's never happened to anybody. You can swipe that vulva clean in one stroke, and at least you're not working in outright manure. So a stroke with the sweat scraper, a splash of disinfectant water, go back to work. Then you need a halter, you need some ropes. I like a calf jack, you need an esophageal feeder, and you need a funnel. A funnel so you can get that good colostrum that you milked out in your dip cup poured into your esophageal feeder without spilling it. Disinfectants. Chlorhexidine is going to be my first pick, primarily because chlorhexidine handles organic material the best. And by that you can read whatever manure, dirt, or debris splashes into your bucket while you're working. Tamed iodine is probably going to be your next option, next most common. That's going to be betadine, prepidine, pividine, some sort of a tamed iodine. You need to dilute that till it looks like tea. Diluting it actually releases more free iodine into your water, so you're going to have a better disinfectant quality. Medicines I like to have there, penicillin, or long-acting oxytetracycline, Nuflor, Exceed. Those would be 4 antibiotics that I think will help you right around the time of calving or shortly thereafter. Flunixin and dexamethasone. So flunixin is Banamine, right? We know it by a lot of names, but it is a non-steroidal anti-inflammatory. Dexamethasone is a steroid anti-inflammatory. Dopram. Dopram is a respiratory stimulant. Half cc to 1 ml injected in the base of the tongue can get a calf breathing that didn't want to start otherwise. Realize that Dopram frequently seems to come on and off back order, so we may or may not have it at any given time. We always try to have some, but it can be hard to source at times. You need some powdered colostrum in case you're unable to get the cow's colostrum or the heifer's colostrum. I like you to have a bottle of 50% dextrose or maybe a couple of those around, and then some electrolytes that can be mixed with colostrum or milk. And by that, I mean an electrolyte that uses citric acid or acetic acid for a buffer versus using bicarb or baking soda for a buffer. That way your colostrum or milk is digested better by the calf. So some general rules about when we're going to assist them. Dr. Sanford talked about the ranges of time. And you're going to have to accept my bias here. I get to see things when they go wrong. And so I'm going to tell you that if she's had 30 minutes of active labor, down and pushing, working at it, and nothing has happened, no progress, then you start making plans for how you're going to assist her. That doesn't mean you're going to get it done in 30 minutes. It means you're going to start making plans and making the setup you need to be able to get there, so it's not 5 hours before you get to that cow. Other times you're going to assist. Certainly when there's nothing visible but the tail on the calf, you know you have a problem. A cow that starts and then quits, and you've got no calf showing. You don't want to find that cow in 3 days when that breech calf or that big calf with his head back is dead and swollen. And then a cow with legs or feet out, that's what she got done, and she stops. No further labor, decides to go to the hay feeder and take a snack. Other rules. Wash them first, please. I know, seems like a lot, but if you end up needing a C-section or you accidentally tear that cow either ahead of the cervix, 9 to 3 on the clock face, or down below the pelvis trying to get a leg up, you're going to be a lot happier if you were clean about what you did. She's going to recover and have a chance, significantly higher percentage. So if you're clean, we're going to recover from delivery faster. If you tear something, you'll feel better about it. If we do a C-section, hopefully we won't be pulling the calf out with straw coming out through the abdominal cavity as well. So try to be clean. Okay, some rules about how to size things up. We talk a lot in the veterinary speak side of things about presentation, position, and posture. And so what does that mean in plain English? Well, presentation is the calf coming forward or backward? Posture is, how is the calf's backbone related to the cow's backbone? See, right side up, they're kind of backbone to backbone. Or is that calf upside down? Her backbone's pointing at the sky, his backbone's pointing at the floor. Are they tipped right or left? And then posture is, do we have the head and both front legs? Do we have 2 legs and no head? Do we have a front leg and a hind leg? How is that calf coming? Do we have a head and no legs? Couple things to think about. Look over here on the side of the slide. We talk about determining what you have for legs, and all of us have looked at feet sticking out of a cow and said, well, if the soles are to the sky, it's hind feet. If the soles are toward the ground, it's front feet. I think you should consider more importantly that if you'll count the joints from the hoof to the point, you won't go wrong. So every foreleg is going to have a fetlock and a knee before you get to the point of the elbow, and a hind leg is only going to have a fetlock, and then you'll get to the point of the hock. And that gets even handier when you're untangling twins. Then we're going to think about the condition of the cervix and the uterus. So when you go in that cow that seemed to start and then quit, and you're going to be ahead of the game, and all you find is a cervix that you can only get 2 fingers in, and when you bring your fingers out, they've got some of that mucus plug on them, then you can be comfortable that that cow was not there yet. On the other hand, can you reach in and do you have a fully dilated cow? Is the only thing restricting your work the bony pelvis? The other thing I want you to think about once you determine whether a cervix is dilated or not is how much soft tissue room do you have? When you reach in, do you seem to go through kind of a tight hole and then you're out into a big open space? And if that happens and you back up, can you sort of feel some twisted fold lines in the birth canal wall? Or do you reach into a big open space and you don't feel the inside of the uterus, you actually feel the outside of the uterus? That cow may have already torn herself, straining, pushing on a calf. Maybe she's had it and you didn't find it yet, and you've got a bucket handle tear from 9 to 3 on the clock face, and you're actually putting your hand out into the cow's abdominal cavity. If you feel the outside of the uterus, it's going to feel smooth, muscular, may have some little ridges in it. Now let's talk about pelvic size versus calf size. I want you to assess that with the strength of 2 people, not with the calf jack, the come along, the block and tackle, lariat rope run through the handles and back to the post and back to the handles. Can you pull with two people, the head and both front legs, all the way to the elbow? If you can get that in the pelvis, just with two people pulling, you can be pretty comfortable that you can pull that calf with some mechanical advantage without either crushing his chest, breaking the first 5 ribs on either side when you do it, or hip locking the calf when you get to the hips. With a backwards presentation, can you pull with two people the stifles and the start of the hips into the pelvis, and hopefully you get the tail coming as well. That's before you add the jack or the come along. We prefer you add the jack. And you're going to do this with, again, two people pulling. So now let's talk about assisting the delivery. The manipulating and repositioning part of the assisted delivery is a timed event. Actually getting the calf out once they're in the right presentation is a point where you can take a bit. But when you are repositioning and trying to get started, you get 15 minutes to make some progress. If after 15 minutes you have not gotten anywhere, you get 15 more minutes. And if after the second 15-minute period you've gotten no further than you were when you began, you need to make another plan. Every time you make good progress, you get another 15 minutes. And I'm going to tell you that repositioning a calf is best done on a standing cow. And it's better yet if she's not under a bunch of pressure. So certainly everybody's seen all kinds of maternity pins, but I know there are people out there that like to put them in a squeeze chute. Maybe a squeeze chute they can V the floor in on and keep that cow on her feet. If you choose to do that, don't squeeze her a lot when you're trying to reposition the calf. You don't need the extra pressure. Now, let's say you tried to reposition her standing and she either goes down or she's down when you start and won't get up. I want you to halter her, tie her head, put her on her chest, and then I want you to frog leg her. And that means you're going to pull both hind legs straight out behind her and tie them with ropes. And she's probably going to wiggle a little, and she's going to show you that the shortest distance between 2 points is a straight line. And until you get enough slack gathered up, she may not stay on her chest. But once you get her on her chest with her pelvis tipped forward, you have disarmed her pushing, and you can reposition that calf with her on the ground. Once you get the calf the way you want it and you've determined that it's a calf you can pull, and hopefully after all this work you can pull it, then you roll her, turn her hind feet loose and roll her over on her side and let her help you deliver the calf. Put her in a position where she can push. Let's talk about applying chains. I personally like a 60-inch OB chain rather than a head snare. That's what works for me. That's what I feel like I can keep clean for you. I also like a couple of short chains to apply the legs. So I tend to chain each leg individually and then have a chain for the head. So we have some pictures here of some do's and don'ts, but we chain the head. We want to loop a chain that goes behind the ears, comes down the sides of the cheeks, and you center the loop in the calf's mouth. That allows you to have control of the direction of his nose, and it allows you to pull on the back of his skull. If you go around his neck and simply around his throat, his nose waves all over the place, and you're probably causing soft tissue damage to the pharynx and the larynx, and he's got to be able to swallow, or she's got to be able to swallow when she gets here. So I don't like it around the neck, and I don't like it around the lower jaw. Sometimes it's easy to get on the lower jaw, but it's also easy to break the lower jaw. So around the head, behind the ears, through the mouth, and now you've got control, and now you can pull. When you're putting chains on legs, so your loop goes above the fetlock, your half hitch goes between the fetlock and the dewclaws. I will tell you that occasionally people have said to me, you know, I've heard you should always half hitch your chains, and I didn't realize that you put the half hitch on the other side of the joint from the loop. So that I thought here a picture was good for you. Put your loop above the fetlock, put a half hitch below the fetlock, below the dewclaws, above the hoof. I really don't care if the chain runs over the top of the leg or down the bottom of the leg, but you need to have it either directly over the top or directly under the bottom. If you run it down the side, you run way more risk of breaking the growth plate. Okay, so we don't need to break the leg. If you don't do a half hitch, we'll talk about that in a minute. I personally like to run that chain over the top surface of the leg. I feel like it pulls the foot in a smoother fashion. When you flip it the other way, it tends to stand the toes up so that they kind of snag on stuff. So I like my chains down the top surface of the leg. If you skip the half hitch, you can end up with a crush fracture of the leg right above the fetlock that can be very difficult, if not maybe impossible to get to heal, because you may crimp off the blood flow to the foot once you break that leg. So I try to avoid those. Let's make our half hitches when we need them. When you are simply repositioning the calf with manual tension and trying to get a leg to where you can work on it, you don't necessarily need a half hitch. At that point, when you're actually ready to apply some serious tension, you do need a half hitch. And here's just one for those of you who have ever delivered a truly big calf with a calf jack. You may have to stop partway along and slide your chains up above the knee or the hock to have enough calf jack pull to get them all the way out. Maybe not as big a deal in Angus cow influenced Montana, but certainly there are some calves that are pretty long when you start to deliver. Okay, anterior presentation, forward presentation, we've got a leg back. Let's talk about some basic stuff to do to correct that problem. So let's repel the head. All right, we've got a head and a front leg, or maybe just a head. So let's repel the head. You can put your chain on it first. Don't ever lose an advantage that you have. You can chain it first and push it back with the chain on. Go find your foot, cup it, or curl it in the palm of your hand, protect that uterus, bring it up. Be sure that both front legs or both legs that you're going to pull with are indeed forelegs, and make sure that they go back to the same chest and neck that goes with the head that you have chained. And then chain your legs, bring the head, line the calf up, and if it fits, pull the calf. Okay, now we've got a head back calf. So 2 legs, no head. Repel the legs. I know, there they are, right? I don't feel that you necessarily need to put a chain on a leg at this point. You can if you want to, but tuck those legs back in under the pelvic brim and go track down the head. Trace the neck, find the head, reach down, and now you're going to try to manually reposition the head. You're going to find his eye sockets. That's a place you can put your fingers to help lift. You can use his mouth. I like to hook a cheek with my finger. I find that you can pull pretty hard on a cheek and not hurt anything. I don't like to grab the lower jaw. I feel that yes, it's easy to get a hold of, but it's easy to break. Chain the head. Put your chain around the ears and back through the mouth. Bring the legs up. Chain them up. Pull that calf with his legs while keeping his head positioned with just manual tension. So we may put the legs on the jack, we'll just pull the head by hand. Now, let's say we can't manually reposition the head. You couldn't do it. You can't reach it, or you can't do it with one hand. Ball up a handful of chain in one hand, whichever hand's going to be more natural, and deposit that handful of chain at the upper ear, meaning you're going to go, that head's going to be up one way or the other. Drop it behind the upper ear and down behind the pole, reach under the head, capture the chain eye loop at the end, and I mean capture. Sometimes you feel like you captured it by the time you get your finger on it. Bring it along the down jaw into the mouth, bring it through the mouth, and bring that eye loop up into the pelvis and hold it there with one hand. Now go with your other hand and bring the second eye loop of the chain to that hand in the cow, pass it through eye loop number 1. You've now got a loop formed. Work the slack out of that loop. Be careful you don't pull it off his ears while you're doing that. Work that down, keep working the slack out, get it in his mouth. Once you've got everything lined up with the loop properly tightened around the ears and ending at the mouth, now you can start to pull. You're probably going to put a handle on and pull up on that chain. And then put one hand underneath his head and lift and pull. You get the head repositioned, go for the legs. We have an upside down calf. So we're gonna go into this anterior presentation calf, and he's upside down. Before you get real excited, I want you to assess the birth canal to see if you feel any twists or folds. You always want to bring that calf around, bring that head up in a direction that will untwist any folds, because some of these upside down calves are in a slightly twisted uterus. And sometimes what feels like the short lift to get the head where you want it is actually tightening the uterus. So think of the uterus as an empty feed sack with a calf stuffed in it, and the neck of the feed sack open. If you turn the feed sack while turning the calf, you can twist the neck of the bag shut, and now you can't get the calf out. So try to assess whether or not you have folds, and then you may have a calf that feels like you want to bring his head up on the left, but when you feel the folds, it feels like the uterus went to the right. You may have to push that calf's head back across the bottom and bring it up the right side, the long side, to untwist the uterus as you bring the head. So we've chained the head. We talked about that. We're going to chain the down leg. Pull on the head first. Try to get the head coming. The body will follow the head. And then once you get the head coming the right way, lift on the head, turn on the chest with a hand, and then pull your down leg and bring the down leg in the head. And he spins, calf's in the pelvis, go get the other front leg, assess the size, deliver the calf. Forward presentation, but you reach in there and you've got nothing but a back facing you at the pelvic inlet. You're going to try to assess which end of the calf is closer to the pelvis, the front or the back of the calf, and then push the opposite end away and try to bring the near end to you and deal with whatever positioning you got to do, whichever end of the calf you're working on. And then you're going to pull the calf. If you can't reposition the calf due to his size, then you're probably looking at a C-section or a fetotomy based on whether or not the calf is dead or alive, or how fresh the calf is. I would like to point out that this is the reason we might not be able to answer the phone. It might be blowing up in your pocket, but there's not much you can do about it. So leave me a message. We will get to you. Promise you. Okay, backwards calf, upside down. We're going to repel the calf a little bit, so pushing forward, bend a rear leg, and use the hock and the fetlock and the cannon bone or the shank to roll that calf. Bend the leg, hold the hock with one hand, hold the fetlock with the other, and turn the calf. You can't get that to work. You can chain a leg, push the calf away, then pull up on the chain while lifting under the hip of the chained leg, and repeat that process a couple times, bumping him back and forth, lifting and turning. You should be able to get him turned around. And then let's talk about the true breech. That is the calf that's got nothing presented but the calf's tail. You're going to have to repel that calf's tail head, so push that away from you. You're going to reach down between the rear legs. You're going to avoid the umbilical cord if you possibly can, and cup a foot. Now, once you got a hold of the foot, you're still repelling the tail head. You're going to bring the foot toward the calf's midline and put your elbow against the hock of that leg and try to rotate the hock out. And as you make progress, again, you try to keep track of the umbilical cord and not tear it. You tear that umbilical cord while you're getting the first leg, you probably won't be able to get the calf out in time before he runs out of oxygen. He's not going to bleed out. He's just not going to be able to get any oxygen. So you're going to repel, cup the leg, push the hock out, bring the leg up, and repeat. Try not to tear the uterus. There are two places to worry about. One is below the pelvis where you're bringing that foot up, and two is ahead of the cervix at the roof of the uterus as you push the calf's rump away. So try to take a little time and give her a little bit of time to relax, because she's been pushing on this thing and she may be locked down pretty hard. You just shove it away and you may tear the uterus. Okay, true breech, big calf. You can't reach beyond his hock. His hock is a full stretch to get to it. So pinch his tendon above his hock, hard as you can. If he's alive and he kicks his leg at you when you pinch him, you just might be able to reach around the front of that hock and bring him up, get it bent, get the hock bent. Now you can reach the foot. But let's take the scenario where you pinch him and nothing happens and you can't reach beyond the hock. Take that 60-inch OB chain, reach down, pass it around the hock, make a loop, pull on the chain to bend the hock. Now you have the hock bent. Can you reach the foot? Still can't reach the foot? Work your hand down there and work that loop of chain over his hock and down about halfway on the cannon bone or the shank. Tighten up again and begin to pull on that. And hopefully with that, you can get the foot into reach. Now you got to determine if you can move the foot once you have it in reach. But if you can't, you're going to slide your chain down a little further. You're actually going to go all the way beyond the dew claws and get it around the pastern. And that's going to help you bend that foot. You're going to cup it, and someone else is going to help pull on the chain a little bit. You're going to cup the foot with one hand, repel the hock with the other. And between the two of you, you should be able to work the foot up and around. If he's just too big, you won't. But on a calf that you can correct, that might be the tip it takes to get that first foot turned around. Then we're going to repeat the process for the other leg. And then we're going to hope the calf is small enough that you can pull him at this point. I would suggest that most of the time, if you can get the breech corrected, the true breech corrected, you can pull the calf. Let's say she's a big cow. Maybe she's a bigger cow than you are a long-armed person. You may need to have somebody help you repel the tail head with a small toilet plunger, or perhaps a frick speculum. A frick speculum is about 20 inches long. It's a round tube. You've seen us put a stomach tube through it to tube your cow. It goes in the cow's mouth so she can't chew on the tube. It has a nice round hole in the end, right? That'll fit over a pin bone, and you can use that to extend your arm to push that tail head away. Now, we've determined that the calf will fit. We've got the calf in position. I generally use a calf jack if I think there's any question about the calf being large enough that we might stall out while we're pulling him. So if you go ahead and determine things will fit, get started, and then stop and put your calf jack on, you're ready already when things might get tough later. So you're hooked up to the calf jack. I like a calf jack that will walk the shoulders one at a time. I also like a calf jack that I can release pressure on in about a blink of an eye. And so for me, that's the calf Easy E calf puller from Ideal. Used one for a long time. I think that that's the only one that I'm comfortable with that I can both walk the shoulders and dump the pressure at the time in the timeline that I want to be able to do it. You can dump the pressure off that calf literally as his mama drops to the floor. So pull straight back. I know we all pull down at some point, right? But when you're first bringing that calf, keep the pole up, work the jack, pull that calf straight back, and when she pushes, then take the pole toward the ground. She quits pushing, bring your pole up, gather up the slack, jack some more. You'll probably stimulate another push, go to the ground again. If she's on her side, same thing. Go up toward her tail head, crank on the calf. She starts to push. You bring it toward her hocks. Work him out. Work with her. This is a time where you got a little bit of time, especially if you got a forward calf, because calf coming forward is not going to get his umbilical cord pinched until his chest is well started. And the calf will sometimes benefit from that squeeze of coming through the pelvis. Tells him he's changing from being a fetus to being a calf, and he's ready to, it's time to breathe, big boy. Once the calf comes through the pelvis, we're going to roll him a little bit. This is on a forward presentation. We're going to roll that calf to one side or the other so we can slip the hips through the pelvis To do that by hand, if two of you are pulling, or maybe two and one of you on the head and things are going well, you get the chest through, just switch handles quickly with your partner. That will roll the calf. You don't really have to slow up much. Out he comes. If you're on the jack, dump a little bit of slack just as you get the chest through and grab him by the chest and turn it and then go back to work. If you're pulling a backwards calf, once you get to the point where you've got his hips coming through, his umbilical cord is under pressure against the front of the pelvis. It may even be getting torn off at that point, and you need to go ahead and deliver that calf fairly promptly. And I would submit, if you're on concrete, try to catch him so he doesn't crack his head on the floor when he comes out. And I would also say that on a backwards calf, already being on the jack, already being ready is beneficial so that when you got the cord under pressure, you can just steadily keep bringing the calf. You're not trying to now get on the jack. So the calf's on the floor. Let's think about a couple things: metabolic condition of the calf and physical condition of the calf. Most calves that have had a dystocia are going to be worn out, and they're going to have some systemic acidosis, or one or the other, or both. And an acidotic calf is a little bit anesthetized, and he's going to take longer to get up. He's going to take longer to nurse. So on the calves we pull, let's try to get a pint to a quart of colostrum in that calf after you pull him. He will get a lot smarter and a lot livelier with a little bit of colostrum in his belly. I don't think that a pint or a quart is enough to make his passive transfer complete. Not saying that, but a pint or a quart on a calf, newborn calf, will certainly give him something to start with, start getting him warm, start making him think. If it's pretty cold, you can spike that colostrum with 150 to 250 mils of 50% dextrose. That will rapidly help him correct his hypoglycemia. Calves don't digest table sugar, okay? So dextrose is 10 glucoses, and glucose is what a calf wants. So let's give him 50% dextrose, or let's give him that electrolyte you had that will mix with milk or colostrum, and we can start to correct his low blood sugar. That's the hypoglycemia, and we can correct his acidosis all in one move. Let's keep him warm. A warm calf is going to absorb more colostrum than a cold calf. Give him the same amount, the warm calf wins. And he's going to correct his body pH and his energy deficits faster. Then let's have a look at his physical condition. Hopefully we didn't break any legs pulling this calf. We used our half hitches. How big is his tongue? Is he going to be able to nurse in a reasonable amount of time, or are you maybe going to have to feed him again? Realize if we give him a little dexamethasone because of a hard pull or a swollen tongue, that dexamethasone speeds the closure of the gut, speeds up the process toward the calf not being able to absorb colostrum. So if you use dex, you better hurry the colostrum a little bit. Look at his umbilical membranes. Are they long enough to protect his umbilical cord? If they tore off flush with his hair, then that calf might need some antibiotics to head off a navel infection. How's his mother? Well, the first thing you're going to do for his mother is you're going to check and see if she's got twins. Some of you are not going to do it on a big calf. So be it. Check for a twin. And after you get the twin out, wipe her off and check for a triplet. You'll be a lot more proud of yourself when you knew you had triplets than when you found out you had triplets 4 hours later. Prolapses. Vaginal prolapses are usually something we deal with ahead of calving, and they're usually going to resolve after calving. Uterine prolapses frequently can occur after a hard pull, especially in a heifer, and especially if the back end of the cow or heifer ends up downhill in the pulling process. So when you're checking for that twin, you're also able to see if the uterus is coming your way. And if it is, perhaps you can get it pushed back before it's too late, and then get her on her feet. Metabolic condition, heifers and old cows may be short on energy. A little Keto Plus can help them. We're getting there. Always check your uterus and your birth canal for a tear, so you know ahead of time. Give the cow some oxytocin so we can contract her uterus and aid you in milking out the cow and giving the colostrum to the calf. And then consider whether you need an antibiotic based on how well things went.
Hey, Will, we have a question in the chat. It would be, could you explain systematic acidosis a bit more?
Certainly. We'll back up. So systemic acidosis in the calf, I think is what you're asking about. And the calf has been under quite a bit of stress. He's been getting squeezed. He has probably been tense himself, and his oxygen levels have probably been reduced. So he's probably burned some of his sugar in his muscles and turned it into lactic acid. Actually, he's probably fermented the sugar instead of burning it with oxygen. So that would be the source of the systemic acidosis. It relates to maybe not having enough oxygen soon enough. And so a systemic acidosis acts to anesthetize or make the calf sleepy. And so when we give them electrolytes, when we get them out and get them breathing better, they can blow some of that acidosis off through breathing. They can get some fluid in their belly and their kidneys can start working. They can start working on the acidosis by moving that out through their urine as well. So does that answer the question? We're going to correct it with oxygen. We're going to correct it with an electrolyte with a buffer, citric acid, acetic acid.
That was perfect. Thank you.
And then I'll take you back to calving method number 49. You got to be quick if you wear the bear suit. Some of our cows will come get you, I think. And it'll be an athletic contest to see who's faster, the bear or the cow or the guy catching the calf. Our contact information's on this page. There's our phone number, our email, our website. I have to thank the vet group in Australia for the pictures of how to check the calf up. And with that, I'm done.
All right, perfect. Thank you so much for presenting. We do not have any questions in the box yet, but I would love to see any questions coming in. We would like to have you guys fill out a survey, which will be linked in our chat box here if you guys are willing to do so. We have been recording this entire conversation and it will be available via our websites and our Facebook pages later on in the week. Thank you guys for watching and presenting as well. All right, so we do have a few questions coming in. Can you speak to J-lube being potentially toxic to perineal cavity of the dam?
Absolutely.
Yeah.
It does not take very much J-lube in a cow's belly to kill her. So I tend to wash the cow, dust a little J-lube on her vulva, and wet that with a splash from the dip cup, and that's about as far as I go. When we talk about pumping J-lube into a cow to sort of lube her up, if you've kind of missed the best window and things are a little dry, there is always the risk that if that cow tears or already has a tear, you are maybe going to save the calf, but you're certainly not going to help the cow. So I'm pretty sparing with my J-lube, but a little J-lube on the vulva will certainly make the job easier for both of us.
All right. Thank you. All right, here's another question. It was mentioned that nutrition could be a key to dyscosia. Have you seen anything in particular that could be missing?
Is that question for me or for Dr. Sanford?
It is not addressed to a specific person.
I guess I'll just say it from a standpoint of in general, I was referring to, we definitely don't want our our cows or heifers to be too thin. They need that energy to get through calving properly. I think I've probably heard it before of trying to starve out the dystocia, and I don't believe we can do that. So definitely don't want our females too thin. Dr. Oliver, I'll let you speak to that.
On the flip side, I agree with that. Don't do well, and remember, if they're thin when they calve, then breedback is going to be adversely affected, right? By condition that calving is the number one correlator to when she's going to breed back. But also, overly fat cattle, maybe overly fat heifers with maybe a little too much readily available calcium in their diet every day and not enough exercise, will sometimes give us fits with urine inertia. They just won't push when the time comes. So I think you keep them in good flesh and you try to make it so they got to do a little walking so they stay in shape.
Great, thank you. Do you prefer the frog leg position to disable pushing, or is it better to do a spinal block of some kind?
That depends on the situation. Sometimes I prefer both. If they're standing and there's the opportunity to give her an epidural, that can certainly be beneficial. If they're down or they keep falling down or dropping down, sometimes even in the face of an epidural, then if she wants to be on the ground, I'm going to give her about one chance and then she's going to stay there. And then working on a cow on her side on the ground who's pushing on you is pretty tough. So if you can roll her over and frog leg her and get things the way you want them, now roll her back on her side and let her help you with the pushing instead of hindering you.
All right. And then the next question, at what point do you recommend the introduction of Pitocin in the birthing process?
And we must be talking to a nurse if we're using Pitocin. I tend to save it for after I've got the calf delivered. A little different maybe than inducing a mare or inducing a woman. You get to places and they tell you that they've already given the cow some oxytocin, and sometimes that means we get there and we've got a tightly contracted uterus around a big calf that we need to manipulate. So I lean toward oxytocin once I have the calf on the ground.
All right. So that wraps up our questions. Will we be able to get these slides from both of the presenters tonight?
Sure.
Okay, perfect. That's been one of
Andy wants
the...
to know if we should have the cow right or left. Once she's pushing, let's have her right side down, left side up.
All right, perfect.
Just one other comment, Dr. Oliver, or a question I was hoping you would address. You had that oxytocin question. With that retained placenta, I know sometimes you end up getting folks where that cow's been walking around and we're not sure how long that placenta's been hanging out. So can you address when oxytocin will work and when it won't, or how long rather?
Sure. So oxytocin is going to work in the short term right after calving. And if we've gotten out there 24, 48 hours, we're going to use a prostaglandin. So I like oxytocin right after calving, help them clean, get some milk let down, contract the uterus. If we've got a retained placenta cow at day 24 to 48 hours, I'm probably going to reach for a long-acting prostaglandin.
All right, thank you so much. It doesn't look like we have any more questions in the comments. Thank you everyone for participating and coming out, well, not coming out, but visiting on Zoom and learning about calving this evening.
Thank you.
Well, Dr. Oliver, it was great to hear your presentation. Really enjoyed all that information. It was great to finally see you. I've heard a lot of great things about you. I know we've had you out at campus, so it's great to see you.
Thank you for that. Good to see you.
Yes, sir.
Appreciate your help, and I hope we help some people.
For sure. I completely agree. Well, you have a great evening.
You too. Thank you. We'll see you.